Hey everyone, welcome back, your place for real health, recovery, and body optimization. In today's video, we're diving deep into one of the most fascinating and satisfying experiences in the world of physical therapy: chiropractic full body cracking and adjustment. You've probably seen those viral clips where someone gets their back, neck, and even hips cracked and walks away feeling completely reborn. But what's really happening behind those satisfying pops? Is it safe? Who is it for? And what are the real health benefits beyond just the sound? Whether you're new to chiropractic care, thinking about getting your first adjustment, or just curious about the science behind the crack, we're going to break it all down for you today. So sit back, relax, and if your spine has been feeling a little off lately, you'll definitely want to watch this until the end. Let's get started. Introduction. What is chiropractic? Let's start with the basics. Chiropractic is a healthcare profession focused on the diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system, especially the spine. The main philosophy is that misalignments in the spine can affect the nervous system, which in turn can affect overall health. A chiropractor is trained to identify these misalignments, called vertebral subluxations, and use manual techniques to realign the spine and restore function. The practice was developed in 1895 by Daniel David Palmer, who believed spinal misalignments could interfere with the body's innate ability to heal. Since then, chiropractic has evolved with research, techniques, and global recognition. But chiropractic isn't just about pain relief. It's about improving how your body works and feels, enhancing your ability to move, perform, and recover. How chiropractic works. The spinal column houses the spinal cord, which acts like a communication superhighway between your brain and the rest of your body. If any part of the spine is misaligned or restricted, it can create pressure on nearby nerves. This may result in pain, back, neck, head, tingling or numbness in arms or legs, muscle weakness, reduced organ function in extreme cases. A chiropractor looks for what's called joint dysfunction, areas where joints aren't moving properly or are stuck. These dysfunctions can result from poor posture, for example, slouching at a desk, trauma, accidents or falls, repetitive movements like lifting, twisting, stress, or lack of movement. Chiropractors perform spinal manipulations or adjustments, quick, precise thrusts to restore proper motion. These adjustments aim to reduce nerve interference and enhance the body's natural ability to heal. The audible crack or pop you hear is called cavitation, which happens when gas bubbles in the joint fluid collapse due to a rapid change in joint pressure. What is full body adjustment? A full body chiropractic adjustment means that the chiropractor evaluates and adjusts the entire kinetic chain, from the neck to the feet. Why is this important? Because your body functions as an interconnected system. A misalignment in your pelvis can cause compensations in your shoulders, or a restriction in your ankle may affect your hip movement. Key areas adjusted in a full body session are neck, cervical spine, helps with headaches, neck stiffness, and nerve tension. Upper back, thoracic spine, improves posture, breathing, and shoulder mobility. Lower back, lumbar spine, alleviates sciatica, back pain, and hip tightness. Pelvis and sacroiliac joint, stabilizes your foundation, important for leg alignment. Shoulders and clavicle, affects overhead movement, lifting, and tension. Elbows and wrists, useful for office workers and athletes. Hips, knees, and ankles, essential for walking, squatting, and athletic movements. A full body adjustment can feel like a system reset, allowing your body to move better, feel lighter, and operate more efficiently. Benefits of chiropractic adjustments. Let's talk results. Here are some of the most well-documented and commonly reported benefits of chiropractic care. 1. Pain relief. Proven effective for chronic lower back pain, neck pain, and joint discomfort. May reduce reliance on pain medications, including opioids. Great for sciatica, tension headaches, and shoulder pain. 2. Increase mobility. Restores natural movement in joints. Helps people recover from injuries faster. Beneficial for athletes, dancers, and gym goers needing joint fluidity. 3. Posture correction. Crucial in today's screen culture. Phones, laptops, tablets. Realigns spine and relieves muscle tension from poor sitting or standing habits. Long-term improvements reduce chronic stress on muscles and joints. 4. Nervous system optimization. Since chiropractic affects the spinal cord and nerves, many people report better digestion, breathing, energy levels, concentration. 5. Stress and tension relief. Physical tension creates mental stress. Adjustments trigger a relaxation response, reducing stress hormones and helping you feel calmer. 6. Improved sleep. Better spinal alignment leads to less pain, which leads to better sleep posture and comfort. Many patients report deeper, more restful sleep after adjustments. 7. Preventative health. Regular adjustments can catch issues early before they become painful or chronic. Helps maintain balance, especially in aging adults or physically demanding jobs. What to expect during a full body adjustment? If it's your first time seeing a chiropractor, here's a detailed walkthrough of what usually happens. 1. Initial consultation. The chiropractor reviews your health history, current complaints, previous injuries, lifestyle, and goals. They might take x-rays, posture scans, or perform orthopedic and neurological tests. 2. Physical examination. Checks spinal alignment, joint motion, muscle tone, and trigger points. May test your flexibility, strength, and range of motion. 3. The adjustment itself. You'll lie on a special adjusting table that supports various positions. The chiropractor may use the diversified technique, hands-on thrust, the activator method, handheld device, drop table technique, extremity adjustments for shoulders, hips, knees, and ankles. You'll hear pops and cracks, but they're painless and often feel relieving. 4. Aftercare. Expect some soreness, like post-workout muscle fatigue. Drink water, stretch lightly, and avoid heavy activity immediately after. The chiropractor may give you rehab exercises, ergonomic advice, and lifestyle tips. Who should and shouldn't get adjusted? Chiropractic care is widely accessible, but certain conditions require caution. Chiropractic is helpful for office workers with neck or back strain, athletes wanting better performance and recovery, manual laborers dealing with body imbalances, pregnant women with prenatal trained chiropractors, kids and teens for posture development and growth alignment, elderly individuals with mobility issues. But not ideal for severe osteoporosis, risk of fracture, spinal infections or tumors, unstable fractures, severe herniated discs without evaluation, stroke risk, or vertebral artery disease. Always consult a medical professional before beginning care, especially if you have underlying health concerns. Final thoughts. Is chiropractic for you? Chiropractic full body adjustment is more than just cracking bones. It's a science-based hands-on approach to restore balance, mobility, and function across the entire body. Whether you're dealing with pain, stress, fatigue, or mobility issues, this method can offer natural, drug-free relief. But remember, chiropractic isn't a one-time magic fix. It's most effective when combined with good posture habits, regular exercise, proper ergonomics, stretching and mobility routines, healthy sleep, and hydration. If you're curious, book a consultation with a licensed chiropractor, ask questions, and explore what personalized care looks like for your body.